Good morning, everyone. Wynn Brown here with our Tuesday, March 24th Haywood Healthcare COVID-19 morning update for all of you. Testing update. To date, we have tested 106 total patients. 33 tests have come back with no virus found, so negative. We've had our second positive result overnight. So that's our second total. At Haywood Hospital, we have 4 patients who are what we call patients under investigation. So we are awaiting their test to see if they are positive or not. And we have 1 positive patient, a patient who's tested positive in-house at the moment. Across the state, to date, as of this morning, 770 patients have been confirmed with COVID-19 and 9 total deaths. So just you can see the numbers ratcheting up every day on confirmed findings, and we're obviously starting to see a little uptick as well. As you can tell, from yesterday to today, we do not have a lot of new test results back. So we have 17 that we would consider overdue at this point in time. We think that part of this has to do with that our major reference lab that we're using, LabCorp, it does these tests in New Jersey. And if you've been following the news, there's a huge surge of testing happening in New York, and we think that that might be impacting our turnaround time. We did receive test kits from Quest yesterday, and again, they're going to be testing locally in Marlborough, Massachusetts, so we will begin implementing those tests as well. Some folks have asked me, is there any way to speed up the testing to find out sooner? And there really is no mechanism at this point in time for us to expedite any tests, even for those patients that are inpatient. Starting yesterday afternoon, Winston Health Center changed its mode of operation. It's still open, but really only seeing patients via telemedicine. And so if you are a patient of Winston Health Center or you know someone who is, they still will access their care by calling and contacting Winston Health Center, but they'll be seen either by telemedicine or referred to one of our other practices if they need to be seen in person. There's a memo that, if it hasn't gone out already, is about to go out outlining the discussion I had last night regarding our new PPE protocol. And so be on the lookout for that in your inbox and talk to your managers about that. Part of that is also making sure that everybody who enters the hospital through our controlled entrances, all staff, stop, pause, speak to the screeners who are there, show them your badge so that we know that you are staff. Even though we're not a huge healthcare system, not everybody knows everyone. So not all the screeners are going to know you work there. So please stop and be pleasant and show your badge and answer the questions that they have. I also want to thank the community members who are sewing masks for us. We have over 100 on hand right now, and we need a lot more. So for those of you who are already sewing for us, thank you. And for those who want to do it, you can go to our website and pick up the instructions and then deliver them at any entrance. Let's see what else I have for you this morning. The governor's order goes into effect at noon today, essentially closing down a lot of local businesses and asking people to stay at home. Remember, everybody at Haywood is an essential worker, so you need to come to work as scheduled, and also make sure you have your badge with you. That way, if you do get stopped or any questions asked of you, you can show that you work at Haywood Healthcare, so please do that. Also, a lot of folks, we have our wellness center has been closed. The local gyms are closed. It snowed last night. So I do your best to take care of yourself. There's some great mindfulness apps out there. We have the Peloton riding app on our intranet, and it's free for 90 days if you have a bike at home. And just make sure that you're taking care of yourself as you're taking care of our patients in our community. And I just want to thank everybody for everything that they're doing to care for our patients, to care for one another, care for your family and your neighbors. Make sure you check on them regularly as everybody's going to begin feeling even more isolated as caregivers. That's in our nature, and let's make sure that we are at our best. I'll be back to you tonight with an update of how the day went, and I look forward to speaking with you then. Have a great day. Thank you.